Hello everyone and welcome to the Integrative Disease and Symptom Management course. I'm Dr. Nabil Hanna, professor at Azusa Pacific University, and in this course we're going to have a mix of some knowledge about health assessment, pathophysiology and pharmacology, and how to integrate this information to get to a better patient diagnosis. And the first lecture is going to be about the clinical reasoning in order to create a differential diagnosis. So we need to use some clinical reasoning, and this is how to gather the data and interpret them in order to reach a differential diagnosis and then to reach a treatment plan. And if we want to define what is a differential diagnosis is not a single diagnosis. It's rather a list of the possible diagnoses which may explain the patient's presentation. And there are 5 steps so as we can reach this differential diagnosis list. The first step is going to be first to acquire data. And this data, we're going to acquire it from using the history and physical examination as well as the tests. Then the second step is we need to identify the key features in this data. And the key features are the findings, whether positive or negative, that will help us to differentiate between different diagnoses. And the third step is to create a problem representation, which is kind of a summary, 1 to 2 sentence summary, using some distinguishing adjectives, what we call semantic qualifiers, and trying to put symptoms together in forms of clinical syndromes whenever possible. Then we come to the fourth step, to adopt a framework where we can think and put our differential diagnosis. And finally, we apply the key features to the framework to be able to generate the preliminary differential diagnosis. So now we're gonna go ahead and start step by step into these 5 steps so as we can be able to create a differential diagnosis.